your therapies, your medications, your meals, help showering, and have a nurse on duty at all times. Which do you think would be more beneficial to you as a patient regarding your own health care?
As far as my own health care, as hard as it would be a rehab center, and it would really be unfair to my mom to put it on her to go home because she would try and it would just deteriorate her health.
Okay, so we can start looking in the nursing facility placements since that would be the best option for you. However, I do want to bring to your attention that even in a nursing facility setting, families still encouraged to visit and be actively involved in your care.
Oh, so my family could come anytime they wanted.
Yes.
Okay.
There's some facilities that don't have any specific visiting hours, so it would accommodate your son coming early in the morning or later in the evening. And if your daughter-in-law was able to bring your mother whenever time was convenient for her, that could also be a possibility. So even though you wouldn't be at home, you wouldn't be quite as isolated.
Okay. Could we look for one closer to my home?
Sure, where do you reside?
In Youngstown, on the north side,
Yeah, we could definitely look for
close
something.
to the YSU campus.
Okay, we can definitely look for something in the Youngstown area. That's not a problem at all. Are there any specific nursing facilities that you have in mind?
Well, I would prefer a short-term nursing home instead of a long-term with the the extensive rehab instead of the drawn-out rehab. Um,
So, what I'm hearing you say is that you want to have the extensive, aggressive rehab where you might be in therapy for a couple hours every day instead of maybe an hour every other day.
yes.
There's definitely options out there such as that. I will have to do a little bit of research and find out which one would be most appropriate for you. How active do you think that your family would be with the nursing home?
I I think if it was within a reasonable distance, they would be very active.
So as long as it's convenient for them, they would be able to visit you and be there for you emotionally.
Yeah. Well, I mean, I mean, if it was like an hour away, it would be harder. But if it was somewhere closer to the area where it would be easier for them to get to since they all have jobs and work.
Okay, so what I'm hearing you say is as long as it's someplace close to you, you would have family involved. Would you still have those feelings of isolation then?
If I knew that my family could come at least a couple times a week, that would really help to make it better.
And what about addressing your depression? Do you think that maybe we need to seek other services for that, or do you think that it's just something that you're internally dealing with at this time?
Well, I would like to, if I am put in a nursing home, I would like to get in there, work with my rehab for a while, and see how I do. Because if I see progress in my physical health, I think that'll help the depression.
So it sounds like a lot of your depression is just stemmed from the actual diagnosis of the cancer, and having the surgery on your stomach just made it worse. So it doesn't sound like the depression's coming from lack of friend or family or emotional involvement.
No, my family has been right by my side since day one.
So do you think depression is the right word to use when you describe how you feel?
Probably not. It's probably more just kind of a down mood.
So more of maybe a setback?
Yes.
Okay, so how do you think this rehab will help with everything?
Well, as I said, as I see progress being made, where I can maybe start walking with the walker by myself, getting up to the bathroom by myself without using a bedpan, uh, I just, I think that will really help.
Okay. Now, do you currently have a walker that you're able to use that you own, or is that something that the hospital's been providing?
No, I own a walker.
Okay, and then the hospital and the nursing facility will provide the bedpan. Are there any other assistive devices that you might need once you're discharged?
I pretty much have everything because last February I had hip surgery, so I needed most of the things that I would need now. Uh, the lifts for the toilet, the shower chair, cane. So I pretty much have everything from then.
So it sounds like upon discharge, even from the nursing home, that you won't really need any assistive devices, and hopefully you won't even need to use those once you're home because the rehab will be effective.
That's that's what I would like to see. I think if that's what would happen, I think my whole state of mind would be much better.
Okay, we can definitely look for placement with aggressive therapy that is close to home so your family can remain involved and active. And since you seem to have everything else right now, all we really need to do is work on referrals. So what I'm going to do is I'm going to research a little bit, find some referrals that are close in proximity to the north side of Youngstown or YSU. That way you can look them over and ask your family for their opinion if you like, and we can definitely get you transitioned into a nursing facility so that we can enhance your progress from your surgery and you'll be able to have more of an upbeat mood. That way you're not so sad that you've had these setbacks over the last couple months, and hopefully get you on the road to recovery.
That sounds good.
All right, I'm going to go discuss all of this with your doctor, and I will be back down as soon as I find something out.
Okay,
All right,
thank
thank you.
you.
You're welcome.